Hey, I'm Dan Duncanson. I'm a SIMEDHealth internal medicine physician, and I practice out of our Gainesville clinic. The specifics of what happens during a physical exam will depend on a person's age and their gender, but generally it involves a detailed personal and family history, the taking of vital signs such as your weight, your height, your blood pressure. The examination itself is looking at you, listening through a stethoscope, and touching you, examining you with their hands. And then this is all pulled together for an assessment to kind of create a status of what your health is like at that point in time. And then the development together of a plan of care, which will involve any potential diagnostic or treatments. Everyone should get a physical exam and keep them up to date. Exactly how often they should be done will depend on a person's age, their health history, any risk factors they have, and their personal habits. Generally, adults ages 18 to 39, if they're in pretty good health, about every 3 years they should check in and have a physical. Ages 40 to 64, every 1 to 2 years, and 65 and older, they should have annual physicals. For children in the 3 to 17 years of age, general recommendations are for annual exams. However, the adolescents may be able to go to every other years. And then younger than 3, they should base it on what their pediatrician tells them. It's important for your healthcare team to know the specifics about the medications you're taking. You can either bring the medications or bring a list. Medications includes not only your prescriptions, but your over-the-counter medications and even herbals. And it's important for us to know the exact dose and the frequency with which you're taking them, and sometimes even whether you're taking them in the morning or night. Other important things, healthcare is a team approach, so we need to know who's on your team. So the list of other healthcare providers that you're seeing, um, a list of vaccinations is important so we can make sure you're up to date in your vaccinations. And possibly it'd be important to bring a caregiver if they know more about your healthcare situation than you do, or if they've observed things that maybe you're not aware of, then their information could be part of the effective visit. Possible diagnostic testing may be appropriate, or consultation maybe with a specialist who has more expertise in that particular finding, or sometimes nothing. Sometimes an abnormal finding can be benign, it doesn't cause any problems and nothing to do about it, or other times, at this point in time, it's a minor finding and we'll follow it to see if there's any changes over time. But at this point in time, we would do nothing. Our bodies have millions of different functions going on at the same time. And over time, sometimes things happen wrong with those functions. Some of these missteps are clearly notable and you're going to seek help. Others of them, you might not notice any changes and it will require someone else looking at it, inspecting you, evaluating, or possibly getting a lab test to identify. So I believe a physical exam is all about health. It's a time to make an assessment and to give you feedback on the status of your health and what your potential for future health is all about.